or the lab practical, just because it's not a standard test. There is no standardized test for lateral flexion. The lateral flexion is a movement, and so we feel like we should test all planes when we do our muscle testing. Okay? So for lateral flexion, instead of having, remember when we did upper trap test? What was the test for that? Shrug up?
Shrug.
Okay. Instead of that movement, you actually have the patient tilt their head to the side, right, and then come back up. Except you're going with gravity. So truly, if you wanted to test it against gravity, you would have them in what position? Sideline. Okay? And we don't really do that in therapy. Just never done. Okay? So I would just keep her in neutral. Generally, when I do my muscle tests in sitting, I do them in the neutral position, because putting people in a rotated position and then having them forcefully rotate against you can cause some problems. So usually what I do is just say, can you hold this position and don't let me move you? Hold, 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 hold. And I'm stabilizing here and trying to push her over. Right? And I would do the same thing on the other side. Okay? Hold, 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 hold. Okay, so these are non-standard tests. You'll see them in the clinic a lot. Okay? You don't necessarily need to know them. We're not going to test you on them. But when you get out there and do your clinicals, you'll be doing it like this. Okay? Flexion, sit up nice and tall. Okay? Hold your head. Keep your chin in. Hold, 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 hold. Right? And now I'm testing extensors. Hold that position. Don't let me move you. Trying to push her down. Extensors are going to be pretty strong. Rotators, you have to do the thing where you pull one direction on one part of the head and push the other direction on the other part of the head because you're rotating, right? Remember, you have to have two forces going opposite directions to get rotation. So,
I'm ready.
okay. So I would have one hand on the temple on one side, the other hand on the back of the skull on the other side, and I'm going to push opposite directions. So I'm trying to rotate the head around. Okay? So I want you to hold that position. Don't let me move you. I'm trying to rotate her. Hold, hold, hold. She's a little weak in her rotators. There. And hold that position. Don't let me move you. Hold, 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 hold. Okay? These things can be, if someone comes in after a car accident and they have whiplash, they can't even hold their head up, let alone you try to apply pressure. They can't resist. They're just shaking, and it's really difficult. So we try to do these tests, but we're really gentle, and we're just trying to get something documentable that we can say, yes, this patient has a very weak neck, and these are the numbers. Okay. So the really specific, standardized, good tests I showed you, and then these are some of the other ones that you might see. Okay. Let's do time for time's sake. Let's just move right along.